To achieve the state of complete vaccination among all eligible age groups was a huge challenge for India with a population of over 1.3 billion. On one hand, the whole medical infrastructure kneeled in front of the deadly Covid-19 pandemic. On the other hand, people were struggling to get the vaccination. The challenge became multiple times bigger in remote areas like Sundarbans deltas. Multiple cyclones, brackish floods, and other socio-geo-economical burdens during the pandemic made this population confused about COVID measures, treatments, and vaccination. It was found the population had a lack of awareness regarding the management of COVID-19. Indeed, people in such remote areas were not conscious of COVID-19 mass vaccination. Lots of questions were popping up in their minds, but getting an answer to those questions was hard for them. In such a scenario, Sabuj Sangha comes with the unique idea to understand the status of vaccination and to increase the resilience of the communities in hard-to-reach locations in West Bengal through access to safe behavioral guidelines and appropriate health services. With the support of Save the Children Switzerland, Sabuj Sangha designed a project called Responding to COVID-19, increasing resilience of vulnerable communities in Sundarbans Delta, with the collaboration of Save the Children India. A dedicated team was involved to conduct various planned activities to draw a clear picture of the estimated outcomes. The team was aimed to support at least 2,000 of most marginalized members of the community with direct health services including testing, guidance, and treatment if required. The entire population within the intervention area of 16 village councils of Mathurapur Pathar Pratima, and Sagar Block in South 24 Parganas will be targeted, covering approximately 20,000 people for the risk communication and community engagement. Mobilizing 10,000 individuals regarding the COVID vaccination program by providing support to health and family welfare samitis. Towards the success of the project, Swarnolata Sabuj Seva Sadan contributed a large portion to the management of COVID cases. It was the only affiliated hospital in such a remote area that served the community even in the hardest and roughest time during the devastation of COVID-19 and other natural disasters. Various activities were successfully conducted through this project. Provision for COVID-19 testing services was ensured. Consultation services were provided to identified COVID-19 positive patients. Ensured 40 COVID isolation beds and treatment ward. Conducted community awareness on hand hygiene, COVID protocols, the importance of COVID vaccination, and available treatments of COVID cases. Mainstreaming IVRs across the project areas on awareness of COVID prevention, treatment, and vaccination was done. Outreach camps for awareness building about health and test facilities to encourage COVID tests among the deprived communities, and ensured media outreach.
সবুজ সঙ্গের সহযোগিতায় আমরা সাকসেসফুলভাবে টিকাকরণ ব্যবস্থাটাকে সম্পন্ন করতে পেরেছি। আগামী দিনে যে করোনার জোয়ার আসছে সেই টিকাকরণ ব্যবস্থার সঙ্গে সবুজ সঙ্গ যদি সহযোগিতা করে আরও ভালোভাবে আমরা রেজাল্ট ভালো করতে পারবো। সেক্ষেত্রে আমি আশা রাখি সবুজ সঙ্গ আমাদেরকে সহযোগিতা করবে স্বাস্থ্যকর্মীদের সাথে লিয়াজো করে।
কিছু বয়স্ক লোক পড়েছিলেন, তারা বাড়ি থেকে আসতে পারছিলেন না তার জন্য। আর কিছু সেকেন্ড ডোজ ছিল, তারাও বয়স্ক এবং অসুস্থতার জন্য আসতে পারেনি। কিন্তু সবুজ সঙ্গের ভাইয়েরা আমাদের সাথে এসে যোগাযোগ করা এবং টোটো নিয়ে গিয়ে আশাদের সঙ্গে করে তাদেরকে তুলে নিয়ে এসে আমাদের কাছে ভ্যাকসিন করানো গেছে। এবং সবুজ সঙ্গ থেকে আমাদের অনেক রকম আমরা সাহায্য পেয়েছি। সিরিঞ্জ, ভ্যাকসিন বক্স, হাফ কাটার, গ্লাভস, মাস্ক, এছাড়া ইত্যাদি অনেক কিছুই আমরা সাহায্য পেয়েছি। এবং আমার যে পড়েছিল বেনিফিশিয়ারি যারা, তো এই সবুজ সঙ্গের এই টোটোর পরিষেবাটা আমার খুব ভালো লেগেছে। এই টোটো পরিষেবার জন্য বা দুস্থ গ্রামবাসী অনেক দূর থেকে ওরা এখানে আমার এসে ভ্যাকসিন নিতে পেরেছে। তো এর জন্য সবুজ সংঘ সেভ দ্য চিলড্রেনকে আমার অশেষ ধন্যবাদ।
Extraordinary achievements were counted through this joint initiative. A COVID-19 care center was established with required testing and diagnosis facilities at Sundarbans Delta. Total 2,268 patients visited the outpatient department during the period August 21 to March 22. Out of them, 329 patients were suspected as COVID positive. 83 out of them were found COVID positive after rapid antigen tests, and out of those patients, 45 were confirmed as COVID positive after RT-PCR method. They were admitted to hospital and essential services were provided carefully. 400 rapid antigen tests were done through outreach camps. 6,022 people were sensitized through 474 community-level meetings. 20,875 people reached through 1,948 community awareness sessions till 20th March 2022. 14,827 people were vaccinated during January to March 2022 through the mobilization by 112 community resource persons, 14 community health workers and 10 GP coordinators. The task of making all the population vaccinated is huge, but this joint initiative of Save the Children and Sabuj Sangha has minimized the risk of failure and created an example that has the potential to achieve national goals by supporting the government.